I know we talked about posture, and now more than ever, people are working from home. They're online a little bit more. They're in front of their computer. And so they always have that kind of rounded upper back, head forward posture when they're at their computer, when they're driving their car, when they're on their phone. They're in that position all day. And so that can lead to one of those accumulation injuries where it's just bad posture, repetitive movement patterns over time that result in injury. Hey, what's up, everybody? And welcome to Catalyst for Change podcast. And I'm here today. My name is Jim Adams. I'm the owner of Catalyst Personal Training in University City. And I'm here with the newest member of your professional health and fitness team, Dr. Jeffery O'Guin. He owns O'Guin Wellness, Chiropractic Therapy, and rehab. And then he also runs a personal training studio out of his chiropractic clinic called Embody Personal Training, EMBODY Personal Training, and they are in Kirkwood. Did I get all that right, Jeff?
That's amazing how well you did.
It's almost like I've done it before.
Yeah, you got it down.
Yeah, well, we've known each other for quite a while, since before COVID, really, is when we first met. So, and we've been staying in contact, and I know you were opening up that personal training clinic right during the middle of all of that insanity. Yeah, so I'm glad to finally have you on the podcast, part of the team. And today we're going to be talking about the 3 causes of neck tension. Can I just guess, for those of you guys that are watching this on YouTube, then you can see this. If you're listening to it on audio, go watch it on YouTube. Check out our YouTube channel, Catalyst Personal Training and Nutrition. But 3 causes of neck pain. Does this have something to do with it when you're here?
That can absolutely be a part of it.
Yeah.
And for a lot of people, that is a component. And when we talk about the 3, a lot of times there's an overlap between. So somebody's got, I got some anxiety, I got some stress, I've got some tensions. My mind is always active, and that just creates a little bit. They wear their shoulders up in their ears, and things like that. And then you throw that into a posture where I'm sitting in front of a laptop computer for 6 hours at a time, and I don't get up and move around. Now you've got some abnormal stresses on the spine. So yeah, they can all work together.
Okay. So what are the 3 big causes of neck pain that you see?
Yeah. So I threw out there the first one. For some people, it can be just stress and anxiety. It goes along with that whole cycle of the same people that maybe clench their jaw a lot. My spouse, my boyfriend, my girlfriend tells me, kind of grind my teeth. It makes this weird noise at night. And so in a situation like that, you're thinking there's just this neurological reflex. They're just wound kind of tight. And so the default state for those muscles is just in this low grade chronic contracted state. Mm-hmm. The other thing, number 2, we'll say, could go to posture and what you were saying. So, if I've got this here, kind of what you were saying, that forward head posture, they call it. And usually in cases like that, they need to strengthen in between their shoulder blades, their mid back, that will just help them get more upright. And then, they need to work on some muscles in the deep part of their neck. They're called the deep neck flexors. So that might be something that some people need to do, is I need to improve on my posture, especially if you're sitting behind a computer working all of the time. Now, some people have the opposite, and I just made a video on this over the weekend, because so many people have watched this video and they ask, well, what if I have the opposite thing, what they call the military neck posture? Now, somebody with the military neck posture, they're just more likely to have more forces that come through their neck, and there's more strain, more stresses. And so they just chronically have this tension, which actually takes us into the 3rd category, which is, do they have an actual injury? If somebody's got a disc bulge, if they've got arthritis, and some other injuries, it's going to cause a neurological reflex where the muscles are in this guarded protective state. And so I say that the muscle tension on that, it's kind of an owie on top of an owie. You've got some injury, and then the chronic muscle tension or guarding behind that causes a pain on top of a pain.
Okay. All right. I'm going to go out on a limb and say you're a father. Because whenever you say owie on top of
Owie,
owie,
an owie on top of an owie.
chances are you have small children. I'm just guessing. Tell me your dad without telling me your dad. All right. So so then we go through that. So we got tension. People just hold stress in various parts of their body for whatever reason. You got posture, and then you have injuries. Now, with the injuries, there's two types. There's the acute injury, and then there's just that, kind of cumulative injury,
Yes.
because I know we talked about posture, and now more than ever, people are working from home. They're online a little bit more. They're in front of their computer. And so they always have that kind of rounded upper back, head forward posture when they're at their computer, when they're driving their car, when they're on their phone. They're in that position all day. And so that can lead to one of those accumulation injuries where it's just bad posture, repetitive movement patterns over time that result in injury versus something acute, which is like a single instance where maybe you fall or something, somebody hits you from behind in the car. It's kind of a traumatic, acute, sudden injury. Can you talk about both of those and how to treat those?
Yeah, so you're absolutely correct. You got your chronic and you've got your acute. And then even the acute injuries, I will say sometimes people have an acute injury and they don't have that traumatic event that they recognize. So for example, a disc bulge, disc herniations, whatever terminology you want to use, a lot of times those are these repetitive issues. And, we've heard the saying, the straw that broke the camel's back.
Mm-hmm.
And there's just this one little, I slept funny. I did the same workout I usually do. Whatever they did, I helped a friend move. I hear that one a lot. Yeah, over the weekend I did some extra work. I did gardening.
Mm-hmm.
But they might end up with an acute injury because they've got this disc bulge that just happened. So for treatment for each of these, the chronic and the acute, to kind of come back to answer your question, let's start with the acute, or let's just say there's an actual injury. Maybe it's a disc, maybe it's a joint. What I would do in the office is we do a workup. Might get the history, and then I do some orthopedic testing. We do an exam and find out what tissue is injured, and then we start to do some therapies based on that. So for the disc, it could be maybe we do traction. We've got different traction devices where we take pressure off of the disc, kind of pulling their head straight up. And I know right away if that's going to be beneficial for somebody or not, because I can have them sit there. And if they're saying, yeah, I've got all this pain, a lot of times the disc injuries in the neck, they'll feel it in the shoulder blade. They'll kind of feel it right in between that shoulder blade. They'll come in, oh, I've got a rib that's out of place or subluxated. Mm-hmm. It might be, but sometimes the disc refers right in there. I'll have them sit right there, kind of just get on their neck, and I pull up about 50%. And the ones with the disc injury say, that feels so good. You could just walk around and hold my head up like that all day long. They're going to respond well to traction. More of a joint issue. Maybe they slept funny. They did something where the joint is very irritated. It's locked up. They respond really well to your traditional chiropractic. Give me a good adjustment in there. And those are the ones you free that up and they say, oh yeah, now we're talking. That feels good. And sometimes it's the soft tissue work that I know you're familiar with, the myofascial releases, the soft tissue works. Let's work those trigger points out, the pain on top of a pain. Mm-hmm. And then now we'll get into the chronic, and there's other things. There's stim, there's ice, there's heat, different things that we could explore. But that more chronic one that you were talking about, maybe it's postural related. That's where we can still maybe do some of these other therapies, some adjustments. There's certain stretches that we can do. They're almost always going to do better with this long-term rehabilitation approach. So the things that you do at Catalyst, the things that I do at Embody, which maybe if they are that forward head posture, like I said, well, I need to strengthen their thoracic spine erectors because I don't want them here. I want them upright through their thoracic spine. Maybe they're scapular retractors, the rhomboids. I want to pull them up. And then a group of muscles called the deep neck flexors that take us out of this and put us more into this.
Into that.
And I always tell my client, I just say, because they want to always fix their posture. Like, okay, should I do this? I mean, yeah, you could try to consciously adopt a better posture. But
Mhm.
if you just strengthen the muscles around good posture, that could be something like a deadlift even. People are
Mhm.
scared of deadlifts. I tell people, I give them the cues, the whole bend the bar cue, engage the lats and engage the scapular retractors, keep your chin tucked, do your deadlift. Now what you're doing is you're strengthening around a neutral posture for yourself. You do that for 6 weeks. You're not thinking about your posture so much. You naturally have a better posture.
Yeah, and that's a good point, and I think that's the reason, one of the main reasons you added on the personal training to your practice is that. And I was talking to another chiropractor friend of mine, Dr. Donahue, and what he talks about is getting the treatment to stick and stay a little bit longer, because especially with some of these, whether it be acute or chronic injuries, like you said, they come in to see you, you do your work, they walk out, they feel great. They feel like $1,000,000. Then they go right back to the patterns, the lifestyle, and everything that got them stuck in the first place. So you wanted to throw in some personal training, some strength training on top of that so that it could stick a little bit longer. Can you say a little bit more about that?
Yeah, and you're absolutely correct. And that is the reason why what I found for the last few years, my clients that would be compliant with a certain exercise protocol, or if I would just refer them out. So I had clients that are just stiff, immobile, and have horrible balance and coordination. You should do yoga 3 times per week. I've got yoga instructors that are hypermobile, have too much flexibility, and are always injuring themselves. And I say, you should really do some strength training. I've got a personal trainer you should do. But the people that were compliant with whatever direction I wanted them to go, I would almost always either never see them again, or I wouldn't see them quite as frequently. I'd call them up 2 months later. They're like, thank you so much for the referral. I feel amazing. Whereas the ones that didn't do these things that I would recommend were the ones that were always coming in. I want my maintenance. I need my tune-ups to feel good, which is fine. That helps me out financially. I'll take it.
Mm-hmm.
But I also want to be as forthcoming as possible. I call myself, I consider myself a wellness practitioner. So I want to give you as much information as possible. So that's exactly correct. I opened up the personal training studio so I can say, you know what, I want to keep all of this in-house. And then our style is a little bit, I tell people it's a blend of rehab and fitness. I've had a lot of clients with chiropractors, you never know what you're going to get. And with physical therapy, sometimes you don't know what you're going to get either. I've made YouTube videos on what's the difference between a chiropractor and a physical therapist. And I say this day and age, there shouldn't be much. You've got really good chiropractors and some that are maybe
Mm-hmm.
not so much. And the same thing with physical therapists. But I was running into people that would come in, oh, I did this, round of physical therapy, but they just never felt like they went to the next level. They were just stuck doing the same small exercises.
Mm-hmm.
And I say, well, we got to load those tissues just a little bit more. But if they go to the boot camp style stuff, sometimes it's a little too aggressive for them. They get
Right.
hurt. And so we kind of
Mm-hmm.
find this happy medium of, we do the rehab stuff. We do the functional training, athletic training, the Mike
Mm-hmm.
Boyle stuff, and all of these other great names out there. But we're gonna kind of kick it up a notch compared to the traditional physical therapy office and things like that. We're gonna load those tissues just a little bit more.
Yeah, and I agree
And
with
the
that.
deadlift I used as an example.
Mm-hmm. Yeah, and I
Oh, go
like that
ahead. I think we got a little delay.
That's okay. You said a lot, and there's a lot to unpack there. Number one, you talked about the deadlift, and people were like, "I can't deadlift." Well, there's nothing inherently wrong with the deadlift, as long as everything's healthy. But it's also how you deadlift. Actually, it's more about how you deadlift than just deadlifting. The dose is the poison, meaning like your form, your load, your training volume, all of that is either what makes it a great exercise or, just throws your back out,
Yep.
one of the two. So I know we talked about that in, what was I going to say? Oh, going back to the 3 causes, right? So I know you talk to anybody on the health and fitness team, on our professional health and fitness team, and they'll tell you the worst question is, what do you do for X? Because depends on so many factors, right? There's so many things that can go into what caused it, and then that can determine how to get out of it. But so I agree that it's multiple facets. But you talked about tension, posture, and either chronic or acute injuries. So as you go through, just can you name some ways to relieve or get out of each of those, either tension, posture? I think we covered injury, but let's talk about muscle tension and poor posture. Like, what can people do to relieve that tension? Because most people don't know that their body works with what's called tensegrity, meaning it's like a suspension bridge, right? So if you have tension on the backside and no tension on the front side, then you're going to be out of balance, right? Because this is balled up and this is loosey goosey. So chances are you're going to feel your pain right here, correct? Right. But if you have a little bit less tension here and a little bit more tension here, then you're nice and balanced and symmetrical, and your chance for injury and pain are much less. So what can people do to kind of get out of that cycle?
Yeah, so I would say understanding. I like everything that you just said there, especially the tensegrity and maybe on one side it's too tight, it's imbalanced, versus the other side maybe too loosey goosey. And there are different posture types. So I talked about there's the anterior head carriage, or the forward head posture that that a lot of people are familiar with. They've heard that before. And then I talked about the military neck posture, and they have different predictable muscular imbalances. So I think one of the first things is understand what your posture type is, so that you understand where those tensions are. Because if you take somebody with the military neck posture, but you're jamming them into more of what they call cervical retraction, or the ears, over the shoulder, well, you might be creating a little bit more tension in there. They sometimes need to let off and go the other way into there. So I think number one is, what is your imbalance? Discovering those, they see a health practitioner such as yourself or myself to say, okay, here's where my patterns are. Now let's get to work on that. The other thing is the stress and the anxiety. That was the other one that you asked about. And that there's so many different things that can go into that. There's meditation techniques. I'm a big fan of breathing techniques and meditation techniques to help control. I'm kind of a high strung person myself sometimes. So I'll put myself in that category. And I almost always do better when I do some form of meditation or breath work technique. There are things like journaling. There's been a tremendous amount of research to show that people that just write down things at the end of the day, whether that's doing to-do lists and, okay, I got a million things on my plate, how do I want to structure this and tackle this? Then you do that. It might be more of a reflective style of journaling. I've got a bunch of things that are just on my mind about a relationship, a job, and I just need to let it out. And so you do some kind of reflective work, but journaling could be a good option for that. Some people might need therapy. They might need counseling, cognitive behavioral therapy, and things like that. But those are a few different things. And for some people, my wife laughed at me when I made that video that caught your attention. I put in there, is it your job? Is it your spouse causing you tension? Get a new job, get a new spouse. My wife kind of was like, oh, get a new spouse, huh?
That could be really expensive.
That could be really expensive. Cheaper to keep her.
Yeah.
And of course I say, I'm joking, it doesn't make sense for most people to get a new job or to get a new spouse, but it could be I need to have a discussion. Maybe I need some counseling. Maybe I need to just figure out, what is it about my job, or what is it about my spouse, and how can I work with my communication within myself, but working with this other either person or people that are causing these stressors in your life, these anxieties, so that you can do something about it. You want to take an active lead in trying to find out what those stresses are and how can you better manage them. And that could be an entire hour-long podcast in and of itself, but there's a few ideas right through there.
Yeah. And I like all of those, I mean, meditation has been a game changer for me as well, because I tend to be high strung. So it's really changed me. But I think there are also some, I use some, what I call lower effort methods, like massage, going to get in a
Yep.
massage therapy can help. And also what I found really works well for me is coffee. Is just scheduling regular coffees with people that I want to talk to. It doesn't have to be about business or anything else. Just, either it's a friend or somebody that I want to hang and chat with, just getting coffee and just talking to somebody. I mean, because that was one of the things that I missed during COVID. My one coffee buddy, Evan, who have had on the show, we lost track over COVID because none of the coffee shops were open. But I want to get back into that practice. So that's really good. And as far as posture, I know you said it was important to identify what type of posture that you have, and that is going to determine your therapy. So once you figure that out, what are some ways that you can do to try to improve your posture to reduce either the incidences or the severity of some of these issues?
Yeah, and I'll say I like what you said, the coffees and things like that, those breaks, because
Mm-hmm.
I think that would kind of tie into what I was talking about, the reflective nature, just having
Mm-hmm.
those conversations. Maybe you're venting, maybe you're reflecting and things like that. So I love that answer and kind of your strategy that works for you. So for posture, so let's say they've got the more common that we describe, that anterior head carriage. You would also mention massage. So we do a lot of soft tissue work in our office, and we do manual therapy. So there's one, it's going to be a little challenging to describe this, but I'm going to do my best. But essentially somebody with this, and if you're watching, some of your clients watching, when that head comes forward like this, essentially the lower part of their cervical spine or their neck is in too much flexion, but then the upper part at the base of the skull extends like this here. And so we've got techniques where we'll help somebody almost kind of drape over the end of one of our tables, but I hold their neck in place so that they're not extending right through this area of their upper part of their neck.
Yeah,
But
where their skull meets their neck.
where their
Yeah.
skull meets their neck, we want to keep that very neutral because they're always extending like that there.
Mm-hmm.
So we want to keep that neutral, but I'll use the edge of a table as a fulcrum and help them stretch that back. And I do that at the same time. I pull on their neck a little bit of traction. So people with that anterior head carriage or the forward head posture, their head comes too far forward, that is a tremendous technique. And usually if we do that 4 or 5 times, now we've kind of set the stage to where now they can take over. Like you said, your other chiropractor friend would say, okay, well, now we need to maintain this. We need to kind of help lock it into place. And so you do these neck retraction exercises. If you're watching, this will be good for you to see. If you're driving, then I'll do the best again to explain it. But essentially you bring your ears over your shoulder, you tuck your chin so that your head's not looking up. You wouldn't want your gaze looking up. You'd want it to be forward. And then you can make a fist and you can essentially kind of drive your chin down as you're pushing your fists up into your chin. And that will help engage what they call the deep neck flexor muscles. Some
Okay.
people do it where they take their fingers, they put it on their head, they keep their chin tucked, they push their head as if they're trying to push their head backwards, and they resist that, and that engages the deep neck flexors. So those could be some options to strengthen. I'm sure, are you familiar with the wall angel? Do you guys use the wall angel as part of a warm up or anything like that?
We may call it something else, but maybe you can kind of go through that.
So it's essentially you standing against the wall, your feet are about, your back's against the wall, slight bend in your knees, your heels might be about 8 to 9 inches away from the wall. And then you make a conscious effort to engage your core or flatten your low back against the wall. For a lot of people, that kind of pulls them in this forward position because it rounds their thoracic spine. They get upright through their thoracic spine when they keep their low back against the wall. But it's a wall angel. It's called a wall angel. Then what they're going to do is bring their shoulders back.
Oh, yeah.
It just engages everything.
We call them wall crawls.
Wall crawls. There you go. Yeah, there's so many names for things.
Mm-hmm.
That's a fantastic postural exercise for somebody with that anterior head carriage.
Okay.
So though, but the really the main pattern for them is they're tighter at the right where the head meets the spine, like you said, really high up top. They're tighter there, and then they're weaker in the front neck muscles. So those are the imbalances. Kind of, you were talking about the tensegrity. Whereas that military neck posture, they're almost the exact opposite. They're almost too much retracted in this here. So we need to facilitate. My manual therapies are going to be a little bit different for them. I'm trying to create a little bit more contour, because the military neck posture, we should have a nice little curvature in our neck and our cervical spine. And the people with that military neck posture, they also call it a reversed cervical curve, meaning they've kind of lost that curvature. So we do manual therapies that help to restore that curvature in there. In that military neck posture, they usually do extremely well with a traditional chiropractic adjustment. So we get in there, do these manual therapies, do the adjustment, and they're the ones that are, wow, I can move my neck quite a bit better now.
Okay. Gotcha. All right. All right. I'm sitting here watching you, and I'm like doing all the exercises. Okay. So that's it. And I'm also thinking, like, which one am I? I used to think I was the forward head. Now I think I'm the military guy. But
and you might be more of a neutral. Most people are fairly neutral. These military neck postures and the anterior head carries, they're kind of outside of the norm. And there's a wide variation of what could be considered normal. But yeah, looking at you, I would say you're probably pretty close to more of a neutral normal. I don't think you're on one end of the spectrum or the other.
Yeah, it's the first time anybody's ever called me normal. Okay. So that covers it all. We talked about tension, how to get rid of that, posture and how important that is, and injury, whether chronic or acute injuries, and how to get over through all of that. So Jeffrey, thank you. Dr. O'Guin, I thank you very much. I appreciate it. And we're glad to have you on the team. So if people want to find out more, reach out to you, get more information, all that good stuff, where do they go?
Yeah, if they want to go to the website, they could easily just go to chiropractorkirkwood.com. We're located in Kirkwood, Missouri, like you said. And then a phone number, if somebody wanted to jot down a phone number, it's 314-822-5300.
Awesome. And all of those links will be in the show notes. Just go to catalyststl.com/podcast and click on this episode of the podcast. All the links to contact the doc will be right there. And he is going to be a regular contributor to the podcast. He's part of your professional health and fitness team. So you will see him again. We'll have him back on the show for sure. And glad to have you, Doc.
Thank you so much, Jim. That was fun. Right. I liked our first session there. That was good.
Yes. After some glitches, we finally made it happen. All right, man. Well, have a good rest of your day.
Thanks, Jim. Thanks so much.